I'm Vic Ross. I'm a dermatologist at Scripps Clinic in San Diego, and I'm happy to be here to talk about one of my favorite combination treatments. So most patients, when they come to the clinic, they sometimes ask for certain procedures, but oftentimes they're kind of, I think, encouraged by the internet to do certain name procedures, and they're not always the best for that particular patient. So what I do is I propose a treatment protocol based on what they come in with. And a typical patient in San Diego comes in with lots of red spots, brown spots, some laxity of the neck. That's kind of a common combination treatment. And so what we do is we outline a six-pronged approach that takes 15 minutes to sort of take care of those issues. So we give a little presentation to the patient via PowerPoint at the bedside. I talk to them about what they're going to look like each day after the recovery, because a lot of patients say how much downtime is there, and I show them what they're going to look like each day, and I say, you decide how much downtime that is. If you're a 911 operator, it may be no downtime. You can go right back to the phones. But if you're selling a $8 million house in La Jolla, which will get you a small house, maybe you might want to look good for that particular client. So we start the procedure after about 1 hour application of numbing cream, and we normally start first with an intense pulse light device. That will address some of the brown issues over the whole face and neck. We do that, it takes about 4 or 5 minutes. Then we proceed to treat specific vascular lesions, typically on the mid-face, with one of our particular vascular lasers. It's one of 3 lasers. It's either the V-beam, the XLV, or the DermaV. They all have the word V for vascular. Then we proceed to treat low contrast pigmented lesions with what's called a Q-switch laser or a picosecond laser. Those lesions turn white immediately, and over the next several days, they come off like coffee grounds. That's phase 3. Phase 4 is in to do what we call a fractional laser, which is usually a 1927 nanometer fractional laser, and that takes care of some of that background, low contrast, sort of mottled color. Then we treat specific little crust. A lot of people have little crust, a little tiny crust that are not pigmented, and those will not respond to lasers that are specifically targeting red or brown. So we just take either an electric device called a hypercator, or we take a little CO2 laser and pinpoint those specific lesions, those little crusts. And the finale, the icing on the cake, is our radiofrequency microneedling system. That involves taking a device that has little needles, about 49 little needles come out in about a 1 centimeter diameter area. And the needles go in for about a half a second, then they come out. And then we move the size of a postage stamp to the next spot. And that's kind of the last procedure. And that's what we do usually for the neck and face. Again, all of that can be done in 15 minutes or less, typically. The main bulk of the time the patient's there is sitting with the numbing cream, going over their notes and computer stuff and things like that, and perusing their cell phone. And then they leave, they're a little swollen a few days, and we give them instructions on how to take care of the spots. And a big part of the program is the patients send me pictures usually at day 2, 4, and 6 through this portal we have, which I was just looking at a few minutes ago at one of my patients, just to make sure the healing is going well, that you're going to have a smooth landing. And that also reassures the patient when I say, look, you're looking fine for this particular day, because patients really don't know, even though I show them the pictures in the room, they don't have a good memory of that. So I just reassure them. And that's a great procedure. It's done very quickly. The patients get a lot of value, I think, in a very short period of time, and only do that maybe once a year for the patient. They don't have to come back multiple times. It's not a series of treatments. And that's my 6-part program to take somebody who's 55 and look maybe 48 or 47.